honor from your organization. I'm really humbled with that. You're right. From 50,000 Jews, only 2,000 survived. That's a 96% extermination in the city of Thessaloniki in Greece. And among those 2,000 were father and mother, who they met after the Holocaust.
honor for business leaders, the 2021 Atlantic Council Distinguished Business Leadership Award. We'll be recognizing his lifetime of accomplishment, but in particular, his and his company's historic role in developing the COVID-19 vaccine, the fastest approved vaccine in history, and thus his ongoing work to help curb the world's worst pandemic in a century. As of this week, COVID-19 has cost some 5 million individuals their lives globally and some 750,000 in the United States. That said, Dr. Bourla's and Pfizer's work quite literally has saved millions of lives through the production and global distribution of the Pfizer-BioNTech vaccine. So it's my honor to host this discussion before Dr. Bourla receives his award tomorrow evening at the Andrew Mellon Auditorium in Washington, D.C., at an event that at the same time marks the Atlantic Council's 60th anniversary. Yesterday, we were joined on this Atlantic Council front page platform by Dr. Bourla's partners in creating this extraordinary vaccine, the co-founders of the German company BioNTech, Professor Ugo Shahin and Dr. Özlem Türeci. Together, Pfizer and BioNTech achieved one of the great scientific breakthroughs in history with its groundbreaking messenger RNA technology. It's at the same time hard to imagine a more dramatic transatlantic success story than this one, born of a science and partnership that predated the pandemic. We'll get all to that in a moment, but first, Dr. Bourla, I'd like to welcome you to Atlantic Council front page.
Thank you very much, Mr. Tenkemp.
So you're a Greek-born American. You've called yourself a Greek by birth and American by choice, the son of Holocaust survivors from Thessaloniki, Greece. As I understand it, there were 50,000 Greek Jews before World War II in Thessaloniki, and only 2,000 survived. And you've written that this upbringing has shaped you. I wonder if you could talk about what it is your parents went through in their childhood and how these origins and how this history has shaped who you are today.
First of all, I need to say what a great honor for me to be awarded with such a distinct honor from your organization. I'm really humbled with that. You're right, from 50,000 Jews, only 2,000 survived. That's a 96% extermination in the city of Thessaloniki in Greece. And among those 2,000 were my father and mother, who they met after the Holocaust. And they decided to build a life together. And then they had me and my daughter. My parents talked to us a lot about their experiences. And that's not very common because a lot of Holocaust survivors avoided to speak to their kids because of it was very painful to remember those stories. But our parents did. And the thing that they always did was that they never spoke to us about hate. They never spoke to us about revenge. They never brought to our attention that we must pay back those that they did that to us or to our family. Not at all. On the contrary, it was always a celebration of life. They were telling their stories, and then the moral of the stories was that nothing is impossible. We almost died, and we survived. And look what we have now, you, our family. I think this is what stamped my personality from the early days. This optimism and this belief that is never the end before it is really the end. And you can always do things to change your fate. And I'm grateful to them for that.
Thank you for that. There's a harrowing story that you've talked about where your mother narrowly escapes a firing squad. Without your parents' survival, obviously, we wouldn't be sitting here today. So thank you for sharing that story. You also said that your Jewish upbringings in Greece, coming from a small country on the world stage, being of a religious minority from the country, taught you to fight for what you believe is right and never to give up. Were there elements of that in the vaccine fight as well?
I believe so, because the personality of someone is really built in the early days, of his life, and then it follows in whatever they do. Ourselves living as a very, very small minority in Greece, of course, you had to learn how to be able to thrive while you are very, very different than everybody else. And the same is as a Greek coming to America with a very thick accent, trying to be able to prove yourself also requires that you fight for what you believe is right. So that also followed me all the way to the COVID vaccine. But the fundamental is that what really helped us and BioNTech and the teams that they worked very hard to develop in record time such a success were two things. One was that we really thought big. These teams really thought big. They didn't try to do the 8 years, 7 years of development. They tried to do the 8 years, 8 months of development. And the second was that there was a very deep instilled sense of purpose. We knew that what we are doing is not going to affect our lives, it's not going to affect our company's future, it's going to affect the lives and the future of the world. That gives you a tremendous drive. And this is what everyone in this team, in Pfizer and in BioNTech, did during these 8 marvelous months.
And it was the fastest vaccine development in history. Did I get that right in the introductory remarks?
Absolutely, with a multiple of improvement.
So before we go on talking more about the vaccine, one more question of your pre-COVID pandemic life. Could you share for us, we all have particularly formative experiences in our lives. Could you share with us in your life of science, the life of science that you decided to take? In fact, you've said as well, and I quote, "My father had 2 dreams, one that I would become a scientist and 2 that I would marry a nice Jewish girl." And it was very sweet what you said. I'm happy to say he lived long enough to see both dreams come true. Please share with us any particularly formative experience that you had before the onset of the COVID-19 pandemic.
I am a veterinarian by educational background, and after I graduated from the veterinary school, I went to science and I did a PhD in the biotechnology of reproduction. My ambition was to have an academic career, and I was really geared towards that. Pfizer Greece, was recruiting at that time, and they reached out to me to offer me a very good position in their animal health group, which in the beginning was very reluctant to take. But eventually they convinced me to do it, and it was always my idea that for me will be kind of a sabbatical. I will go to make a small break in the industry and then come back to what I really love doing, which was teaching and researching in the academia. But I didn't take into consideration that months after I joined Pfizer, I fall in love with the company and fall in love with what they are doing. I fall in love with the private sector because I saw how dynamic it is and how you can make a difference over there. I stayed 28, so far I'm 28 years with the company, and I stayed 3 of them in Greece. The other 25 years I spent internationally. The job was in Athens, so to join Pfizer I did the first relocation, which I found it very difficult to do, from Thessaloniki to Athens. I followed other 8 relocations. I did together with my wife, we lived in 8 different cities of 5 different countries. That was extremely interesting experience. In most of them, our kids had to follow because they were born. But I think it is the biggest gift I gave them. The fact that they were exposed to different cultures, to different civilizations, to understand that diversity is very important, and to understand that the world is not how it looks in New York or in Texas or in Atlanta. The world is very different in every single corner of this earth. I think that was very, very important. And here we are. Everything can be done. A Greek from humble beginnings made it all the way to the top. Actually, when our board called me into the boardroom to announce to me that they have elected me as the CEO, The comment that I made was only in America, because really this is the place that you can really make it to the top, irrelevant what are your beginnings.
I love that story. Living in so many different countries, starting something you thought was a sabbatical and became a life's mission that ended in this amazing, not ended, still continuing, but with this amazing vaccine. So you've seen in these 27, 28 years at Pfizer, the company evolve. You've seen the science evolve. What is it? What were the most crucial factors that both prepared the science and Pfizer for this moment in history and this vaccine development?
Yes, I think Pfizer was had tremendous success in the 90s and beginning of 2000 with science. But then it was a period that was not that productive. So when my predecessor took over approximately 12 years ago in 2010, end of 2010, beginning of 2011, he found a company that needed really to make serious changes in the way that R&D is conducted. And they did. He drove significant changes. We focused our research. Before, we were spread thin in 13 different therapeutic areas. And when you are spread thin in 13 therapeutic areas, usually you're not very good in any. You are mediocre in all. We reduced that to 6 therapeutic areas, and we were able to become the best in each one of them. We consolidated our research centers. We moved our research centers to places where science is happening. We did tremendous changes in the way that R&D is working. All of that under my predecessor. So when I took over in 2019, I found an excellent infrastructure so that I can make radical changes to the company. It is because of the work of my predecessor that I did all of that. And I focused the company on the science. We divested, or better, let me use a better word, we found way better homes for 2 of our 3 businesses. And we created significant improvements in the R&D budget. We increased the R&D budget dramatically. We increased dramatically the digital budget. And also, we reduced the administrative budget in the company. All of that, basically, I took a serious bet in the science of the company. And this I did, as I said, because I truly felt that we are at this time at the same point. So all of that happened in 2019. We brought a very new culture culture that can foster innovation. We increased budgets. We brought digital in the way that we do discovery and development. When COVID happened in 2020, I think a lot of this had advanced. And we were able to utilize a lot of that, plus a very significant shift in our culture, to be able to do things that they were they seemed to be impossible. And this is exactly what happened. It was not luck. We were preparing for 2 years, and we found ourselves to be at the right set of mind so that we can develop a breakthrough in a record period of time.
So I love this story, giving your predecessor, the credit for setting up the company for the changes that then you took on, particularly in the focus on the science. 2 questions. One of them is, give us a little bit of a feeling of when you saw that COVID-19 was going to be the challenge that it became. And what did you move to take it on? And I think the second part of the question, and this is, not everyone watching us right now is a scientist. And so they hear mRNA, they hear messenger RNA, and they don't quite know what it means. I realize this is using the pathogen's genetic code, but if I'm not mistaken, mRNA vaccines had never been used for clinical use before. So I'd love you to talk about what you spotted early on, how you move things, but then the role that mRNA plays during this period of time.
Yes, in January, myself and our entire leadership team were thinking that COVID is an issue that mainly concerns China. And we were very concerned because of that, because we have significant operations in China. We had 15,000 people at that time. We had 4 manufacturing sites. And we were worried about our people and how they would be able to maintain their jobs. So we set up a task force that was really following very closely what is happening in China, and we're trying to make sure that we do the right things. In February, it started becoming clear to me that this might go outside of China. And in the second half of February, I was in Europe to attend an economic forum meeting. And I went there, and then 2 days before, and then the forum was canceled because of COVID. That was, for me, an important alarm went off. I realized that things are serious. That was first time that a conference like that was canceled. So I took the plane, and on the plane I wrote down the priorities that I felt that the company of a company like ours should have. And the first was, I still have this piece of paper actually. The first was, we need to make sure that we protect the safety of our people. The second was, we need to make sure that we maintain the supply of critical medicines to people. I had seen in China that hospitals were overwhelmed, and we are one of the biggest suppliers of hospital products in the world. So I was thinking, how can we maintain a surge in demand that could be 20, 30, 40, or 50% higher for some products than what we had before, while our plants had to operate under COVID restrictions. Very challenging. So I asked that should be a number 2 priority. And then number 3, it is we need to develop a vaccine and a treatment. And we came back. I asked our team to develop vaccine, then bring me plants. They brought me plants that they want to use the mRNA technology. I was puzzled when they told me. I was very familiar with the mRNA technology because we had hired people back in 2015, but the most pivotal, that they were specialized in mRNA, but the most pivotal thing that we did was we had an agreement with BioNTech, a collaboration agreement that was signed in 2018 to develop a flu vaccine by using this technology. So I knew that there is not a single product mRNA out there. So I challenged my team and I told them, are you sure that you want to go with mRNA? If that's going to be successful, that will be not the first COVID vaccine, that will be the first vaccine ever with mRNA. But this work that they were doing with BioNTech, the last almost 2 years, let's say the 18, 19, was giving them a high level of comfort that the technology is mature and that, more importantly, the partner is the right one. So in this meeting, they convinced me that to take that risk and go with mRNA. But then I said, I need to talk to their CEO. And I called Ugur, and that was the first time that we spoke on the phone. It was, I think, love at first sight. And it was the beginning of a tremendous relationship, collaboration between the two companies and me and him, particularly in person. Later, I met also Aslam, his wonderful wife, and who is a pivotal member of the research team over there. And I never, ever regretted that we made this highly risky decision, and I'm happy that we did.
And I'm very excited that tomorrow evening we're going to recognize all three of you, and of course, by association, your companies as well. Just very briefly, can you explain to us how the mRNA works differently? Because not all the COVID vaccines are mRNA. How does it work differently? And why was it ready at this point if it hadn't been ready for clinical use before?
Yeah. Most of the vaccines, the principle is that you are introducing a part of the virus, let's say, into your body, so that your body will create antibodies, will recognize the virus as an enemy, and will create antibodies. Now, you put a piece of the virus so that you will not get the disease, or you put a dead virus, or you put a modified virus, or there are new technologies, but this is the fundamental, that you're putting a piece of the virus so that your body will develop immune response. So when the real virus comes, your body is ready with antibodies, so can win easily the battle, or easier the battle. The mRNA technology is trying to reverse this challenge. So what they are doing, instead of introducing, let's say, a piece of the virus, a protein of the virus, for example, you are sending a message to your cells through a messenger RNA so that your cells will produce a similar protein like the protein of the virus. Once you do that, then your body will recognize this protein that something is not normal, that it should be here, so it will develop antibodies against this protein. And then, the same way, your cells, you will be protected when the real virus comes. So as you can see now, you don't even put a piece of the virus. You don't put any foreign protein in you. You are putting a very small piece, a message of RNA that will stay a few days in your body and then disappears. But those will send the signal to your cells to produce this protein. Very revolutionary idea that really is discovered 20 years ago, and it was studied for all these 2 decades, with the last 5 years way more intensively. And BioNTech was one of the pioneers in doing these studies. Moderna was another one. And eventually, the first success that we were able to do was this product that we developed jointly with BioNTech, the COVID vaccine.
Well, that's just a wonderful story, and a story of how history unfolds. What other doors might this mRNA vaccine open? I've heard there is even a path regarding cancer from this vaccine. Could you share with us what other doors you think this might open for you and for science in general?
I think cancer was the first thing that we tried to tackle with the mRNA technology, and I know BioNTech worked very intensively into that. The idea is that you are training your body to attack proteins of your own tumors. So you identify the tumor, and then you send a message to the messenger RNA to yourself, start attacking this tumor. So it is a very big field that it is studied very intensively right now. Another field, it is the field of infectious diseases. We saw the first vaccine ever, which was the COVID vaccine with mRNA technology. Ourselves, we are working on flu vaccine, as I said, since 2018. And that could be a next generation flu vaccines with mRNA. But also we are working on multiple other targets of creating vaccines for other infectious diseases. And there is a third application, which is for people that they are born with a mistake in their DNA code. And there are a lot of rare diseases that they are happening to people because somewhere in one gene there is one small mistake in their DNA. And those people are, they have to live with that until the end of their lives. And many times their life doesn't last very long because of this mistake in their genes. There are a lot of technologies that are trying to use gene editing, so that they are trying to use same technology to be able to repair the mistake of your DNA, so that you can cure basically those people. So these are just three of the very hot, cutting-edge technological fronts that right now we are working at.
And what's most promising among those? Are we closer now to something regarding cancer and mRNA, or where do you see of those three the most promise over the short to medium term?
I hope so. It's not, we don't have a success yet over there, as we didn't have a success in vaccines, but before COVID. I hope so. But which one is the most promising? I would say that like infectious diseases, other infectious diseases, now we have a very good proof of concept that this works to attack foreign invaders, viruses or other microbials. So I think that's the most likely to bring fruits faster.
So now let's talk about the period of time from March 20th to today. It must have just been an incredible moment of intensity for you. You've written about the hours that your team has put in, the time lost from their families, the time spent over weekends. But as you went through this period, what has struck you most positively and negatively? What do you feel that you've learned through this very, very intensive period, which, by the way, is still ongoing?
I would say two things. The first one, it is clearly the one that stands out for me. It is that when it comes to leadership, people, they don't know what they can and cannot do. And if anything, they have a severe tendency to underestimate what they can achieve. And if people are given the resources and they are given a very big, hairy goal, if you force them to think big, they will surprise you with what type of solutions to any single problem will emerge they will bring. So for me, that was a leadership lesson that is very important. I'll never forget. On the leadership again, if there is something that I regret, for example, we went through a lot of pressure, and I had to put a lot of pressure to my people. I don't regret that I did that, because I know that without that, we wouldn't be here. And I know that my people, they don't mind that I put a lot of pressure to them, because they knew that this is what was needed. But at certain times, it's not that I put pressure. I lost my temper. And that I regret. So the lesson for me is that the leader needs to whatever he or she can, not to come in a position that will stress the people. You can put a lot of pressure, but you should never lose your temper and make people feel unhappy and uncomfortable. So that's another good lesson that I learned, and I try to do less of it, let's say.
That is an incredible lesson, I think, for every CEO, maybe every political leader across the world. And the more one's under pressure, the harder it is to stay to that rule. But thank you for sharing that. In fact, why don't we stay on that a little bit now? Because obviously you're not a politician. You weren't elected as a politician. But you've had to deal with a lot of politics in the last 18 months. What have you learned about geopolitics, major power politics? What have you learned about domestic politics? You've been through two quite different American presidents. You've also learned a little bit about fake news during this period of time as well. So talk to me about what you've learned about geopolitics, domestic politics, and fake news.
Well, clearly it was a crash course for me, and I think that I learned enough to have a PhD in political sciences right now. But unfortunately, the hard way. I tried to protect the company from being involved in the politics. In the US, it was impossible to do that, because there was so much animation and polarization, and health was at the epicenter of the debate. COVID was at the epicenter of the debate. So the development of vaccine became the essence of the debate, which shouldn't be. We shouldn't be discussed in political terms. Only scientists should have to discuss it. So it was every day we tried to navigate the political mindset. And the way that I saw it was that I had to create pressure to our people, but also I had to protect our people from internal bureaucracy, from external bureaucracy, give them the resources so that they can work. So I had somehow to be the shield that will absorb all the pressure, the political pressure, rather than having them going all the way down to them. They should feel that they are, let's say, have to worry only about the lab and their patients. And I tried to do that, and it was not always easy, but eventually I think we didn't hit the mines. The other thing that I learned, because that gave me the opportunity to speak with a lot of leaders, as you have done, Fred, in your career, you realize that they are human beings. Yeah. You realize that they are people that they worry about their people, that they try to do the best for their country. And when you interact a lot with them, you realize also that they have family and they have kids and they have their own concerns. So it was a very humbling experience to be able to do that and literally meet families of many leaders in the world, because we had calls evenings and nights trying to find solutions to their problems. That was also a very humbling experience.
And you shared a little bit in the past about direct phone calls from the President of the United States, direct communication. How do you, in a position like your own, deal with that because obviously there's a lot of pressure on them as well, as you said, as human beings.
Yes, at that time it was President Trump, and I had met President Trump before the pandemic, and we had discussed things of health policy mainly. But of course, the pandemic and the vaccine was very high in his agenda, so he would reach out to me to ask about how we are doing and if there is anything he can do to help us accelerate, etc., which I told him that there is nothing. Yeah. We are moving full speed anyway ourselves, and I just need to let my people work without worrying about politics. And eventually we did it. We brought it very early. I know President Trump would like to see it before the elections. It came after the elections. It has nothing to do with politics. It is just, that was the speed of science.
Thank you for that. And just sharing with our viewers, tomorrow evening when you receive the award, before you receive yours, the President of the European Commission, Ursula von der Leyen, will receive our Distinguished International Leadership Award, but she'll also introduce you for your award, so that shows the sort of respect that can be shared between a political leader and a business leader.
Well, I can tell you that President von der Leyen was one of the most knowledgeable leaders. She knew details about the disease, and she knew details about the technology. And I was very impressed. A lot of our discussions were going really, really to the bottom of what is happening and what will be the best way to address them. And because there were, again, so many and under so much stress, that creates a bonding experience for both leaders. Me from a small company, her from the president of a big company, Pfizer, but compared to what she's doing, the president of European Commission, clearly she has way bigger responsibilities. But that created the bonding with her as well.
Yeah, I think
I respect it highly, highly.
Yeah, it's such an important message to understand the humanity behind all of these very stressful and important jobs. There was some fake news during this period of time about the vaccines, all sorts of conspiracy theories. How did you deal with that, and how did you navigate that, and where do you feel the primary source of this sort of fake news was? How damaging was this to us?
I'm afraid it was quite a lot damaging, and there was, particularly with us, we were targeted by a lot of, let's say, dark organizations that you don't really know the ownership. You suspect that there are some countries behind. We were getting a lot of briefings from CIA, from FBI about attacks that may happen to us, cyber attacks, I mean, but also about the spread of misinformation. There are two groups of people, right? There are the people that they are vaccinated. There are people that are skeptical about the vaccination, and both of them are afraid. Those that are getting the vaccine, they are afraid of the disease, and they believe that because people are not getting vaccinated, they are increasing the risk to them. They are increasing the exposure. So they are, let's say, mad with them that they don't get the vaccine. Those that they don't get the vaccine, they're afraid of the vaccine. And they are mad with the people that are pressing them to get it.
And
those I understand. Yeah. They are very good people. They are decent people. That they have a fear, and I understand it. And they don't want to take chances. But there is a very small part of professionals which they circulate on purpose misinformation, so that they will mislead those that they have concern. Those people are criminals. They're not bad people. They're criminals because they literally costed millions of lives.
And should be treated as criminals as well, those who have done that. You've also come to see close up we didn't all know them before, the inequities in the global healthcare system, which also has influence on recovering from COVID-19. Have you learned anything during this period of time about whether and how one can overcome them, and how did you have to work within them to navigate this period?
Can you repeat the question, please?
It's how you've come to view the inequities in the global healthcare systems.
That was a very, very big issue from day one for me. And I realized that if we have this polarization within the country, for example, I could only imagine what will be between countries when the vaccine will become available if we don't have available for all. So to make sure that the vaccine is available for all, there were two things that we had to do. The first was to have a price that will not become an obstacle to any country. And that was easy to resolve. We set up a price that it is the cost of a takeaway meal in the developed world. But when we are moving to the middle income countries, not in the high, we charged half of this price almost. And when we went to the low income countries, we gave them a non-for-profit price, so at cost. So that was easy. Then the second thing that you need to have, you need to have enough vaccines for all. So it is clear that when you start from scratch, the first month you will have fewer doses than the months after. So we went to all the countries and we asked to place orders. And I saw the orders that were coming. And most of them were coming from high-income countries. The European Union placed orders, the US placed orders, UK placed orders, Japan placed orders. Small and, let's say, low and middle-income countries, they were not placing orders. And I sent letters into heads of states of these countries, urging them to change their position and place orders because the quantities will be allocated. They didn't do it, most of them. And they didn't do it because they placed orders either with other vaccines, from China, from Russia, some other solution, maybe from AstraZeneca. When eventually our vaccine became very successful and we start producing enough quantities, and maybe some others, they have problems to deliver the quantities that they promised, then they all came back to us and they asked that we want also. Problem was that the first few months, the doses were already allocated to countries that they placed orders. I couldn't just tell them, I'm not giving it to you anymore. So the solution was to build more so that everybody can get. And this is where we invested dramatically. And from 1.3 billion doses that we were expecting to produce towards the end of 20, in 21, pretty soon in the first quarter, we raised that to 3 billion instead of 1.3. I'm very happy to tell you that by the end of this year, which is in 1 month and a half, we will have produced 3 billion doses. And from them, more than approximately 40%, more than 1 billion doses, 1.2 approximately, will go to low and middle income countries. And in the quarters that follow, I think everybody will have enough doses because we are producing 4 billion for next year. And just from one company, that will be enough for, I think, a lot. For basically everyone who wants, he can have access.
Wow, 3 billion doses and a billion for low and middle income countries. And part of this was an agreement with, I believe, the Biden administration, U.S. government, where you provided at cost and they are providing to certain countries at no cost. Is that right?
It's absolutely right. And this is the biggest agreement that we did with them. It is 1 billion doses. The U.S. government is buying those doses from us at cost, and then they are giving those doses free of charge, completely free of charge, to other countries. They donate them. The agreement with the U.S. government is that they can give them to whoever they want, as long as they belong to the list of the 92 approximately poorest countries in the world. So they cannot give it to middle income. They need to give them for free to the poorest countries of the world. And this is what they want to do, and this is what they are doing. No strings attached from anything that I know and I can see. They're just giving the doses without asking anything in return.
What a remarkable story. This is a question on a lot of people's minds. Where do we stand today? Masks, jabs, testing kits, are these going to become a more permanent part of our lives, or is there an end to what we're going through as we see different variants rise up here and there, and new need for response?
No, I believe we will see an end. I think we believe that life will go back to the way that we knew before. Of course, there will be changes because of things we learn right now. I think will be changing the way that people work, now that we know that digital works that well. But I think we will reach a level that the normal waves of social life, that we can go to a cinema, that we can go to restaurants, that we don't have to wear masks, will end. To do that, we need to vaccinate with a full series of doses the vast majority of the people. And if we do that, we will have herd immunity, and then we will reduce the virus all over the world. The only thing that stands between the new way of life and the current way of life, frankly, it is hesitancy of vaccinations. People that they afraid to do the vaccines, and they create issues not only to them. Unfortunately, they are going to affect the lives of others, and frankly, the lives of the people that they love the most, because they are the people that they hug, they kiss, they socialize with.
So this is not a political issue, left or right. This is a science issue. And
for God's sake, it is so big mistake, and it was such a big disservice to society to politicize something like that. To become a political statement if you wear a mask or not. If you wear, you're a Democrat. If you're not, you are a hardcore Republican. That's ridiculous. Should not be like that. And it was a very bad service to humanity.
And is there going to be an annual vaccine for COVID-19? Is a booster shot enough right now? Can you see into the future well enough to tell us what you think that looks like?
I think the booster shots, the third dose, is the one that gives very, very high level of protection, higher than the originally achieved levels of protection, which was 95% with the two doses. The question is, how long will it last? And we know that we saw a waning of immunity 6 months after the second dose. We need to follow up for 6, 7, 8, 9 months of the booster dose. If I can take a prediction, because we have seen this type of vaccination curves multiple times and the immunogenicity curves, it looks like that it will last for a year. It looks like that there is a chance that this will become an annual revaccination. However, I have been surprised many times in my life with things that in science we expect and they don't come exactly like that. So we need to wait and see. But the likely scenario is annual revaccination.
Well, this might be a good question then to close on, which is looking further into the future, extrapolating from what you've seen in your life already from science. I'd love, let's go beyond COVID-19. Let's go to the work in general that you see in bioscience and medical science. What excites you the most of the developments you're seeing going into the future? And then perhaps you can also share a little bit with what concerns you, maybe starting with what concerns you so that we can end on a positive note about what excites you. But what keeps you up at night, and then what gives you the most hope looking into the future?
Yeah. The future of the life science sector is brilliant. There is going to be a huge need for good medicines. People are getting older, and not only they live longer, but this means that new diseases that were not important before start emerging. And also people are moving from rural places to urban places. 150 million people in the world, they are moving to cities every year. This means in healthcare from zero access almost to medicines to access to medicines. So the demand will be huge. I think science is at the cusp to be able to provide solutions for this. So the offer also will be there. And this is happening because biology combined with digital technologies right now is unlocking tremendous opportunities for new diseases, for new medical treatments. So all of that, I think, is going to be very good. Clearly, there will be an issue, which is the cost. And I think that's the biggest issue that we are going to face. It's not the cost of medicines, it is the cost to society of people living longer, which means more healthcare costs, more pensions, more everything. I think medicines will, to finish the positive note, medicines will be part of the solution, not part of the problem. The good medicines will reduce hospitalizations, will reduce other medical interventions, and as a result, will bring savings to the healthcare system, rather than an additional cost. And of course, will make the lives of humans longer and better. And I'm very optimistic that this will happen in the next decades.
Well, thank you for that. Because we're honoring you tomorrow evening, and we're honoring you alongside your colleagues from BioNTech, Greek, Jewish background, American, Turkish background, Germans, transatlantic story. A lot of corporate collaborations really don't work this way, and they don't work this effectively. To end this interview, talk about this combination, and why is it that this one has worked? Why is it you've been able to produce something of quite historic nature, where many corporate collaborations among CEOs, founders of companies don't work in quite the same way?
I think it was both companies, they had developed very similar cultures. They were both really very purpose-driven. Clearly, one was very big, the other was very small compared to the big one. The leaders, one was Turkish Muslim that immigrated to Germany. The other one was Greek Jew that immigrated to the United States. So from first glance could be the exact opposite. But I felt the thing that connected us was that we had a common purpose. The first thing that we discussed with Ugur was that when we met on the phone was that what are the principles under which you are going to operate? And we said, doesn't matter who does what. Doesn't matter anything else than bringing the vaccine as #1 priority. That's fully committed? Yes. Are you fully committed? Yes. And that was it. And if anything, I think the fact that we had both a little bit of Mediterranean, let's say, heritage, created even stronger bond and trust. That's the word I'm going to use. Trust. The fact that we had such a big trust from one another cascaded down, and our teams had a very big trust from one team to another. And that was why this thing happened so well.
Oh, I think you've just underscored most of maybe the most important word in any collaboration, which is trust. Thank you for ending this conversation there. Thank you for taking the time for this rich conversation. We look forward to honoring you tomorrow evening. We couldn't imagine any individual, any company, any partner company more deserving in this challenging year where you've contributed so much to so many. Thank you so much, Dr. Bourla.
Thank you very much.